Hello everyone, I am Dr. Rujul Jhaveri. I am an obstetrician and gynecologist at Narayana Health SRCC Children's Hospital at Haji Ali in Mumbai. Today we would be discussing about high risk pregnancies, or more commonly known as high risk obstetrics. So what exactly is high risk of pregnancy? So in any pregnancy there is a certain risk, as you would understand, to the mother and the baby and the unborn fetus and the neonate. So whenever this risk is more than normal, when the mother and the baby in the pregnancy or just after delivery are at a higher risk of complications, all such pregnancies are what we call as high risk pregnancies or high risk obstetrics, the management of which is required in a advanced tertiary level center. So you may ask as to what could be the causes of such a high risk pregnancy. So the causes of high risk pregnancies can be maternal, that is arising from the mother, or fetal, that is arising from the unborn fetus or the neonate, and it can be due to the pregnancy itself. Let us elaborate on that. So maternal high risk factors can be a mother who has pre-existing diabetes, high blood pressure, or who's undergone an organ transplant like a kidney transplant, or has undergone an organ donation. So all these factors can lead to a high risk pregnancy because of the maternal condition. Also some conditions like systemic lupus erythematosus, or more commonly known as SLE, or any patients having chronic arthritis, all this falls in the category of high risk pregnancy, but more of a maternal indication. Other lesser common conditions are maternal cardiac disease, kidney disease, a chronic long standing kidney disease. When these women get pregnant, they would have a relatively higher complications because of the natural changes in pregnancy which occur, and that would be labeled as high risk pregnancy. This is what we call as due to maternal cause. So now coming to the fetal causes which can lead to a high risk pregnancy, there are many such causes in the fetus. For example, fetal abnormalities or fetal anomalies. These are mainly detected in your 5th month sonographies, the 20-week sonographies, when you go for your anomaly scan or your malformation scan. That if the baby has any cardiac defect, any defect in the spine, or any other gastrointestinal defect which requires surgery immediately after delivery, or it may require management in the NICU. So these pregnancies would then be termed as high risk pregnancies. Other fetal conditions include any genetic abnormalities, any chromosomal abnormalities. These are mainly detected on the dual marker or the quadruple marker. Many a time they go undetected because these tests are not offered commonly, and they may present in a later gestation, means at later stages of pregnancy. These pregnancies will also become high risk pregnancies. Other one very common condition is where there is a genetic condition which is running in the family, which many family members are already affected. The couple may have a previous child, the unborn fetus may have a previous sibling which is affected with a genetic condition, and this genetic condition is passed on from one pregnancy to the other, and hence this would be also labeled as a high risk pregnancy. So these are some of the fetal conditions. Other fetal conditions include when the fetus is small for gestation, means the fetus is a low birth gestation, or it may be born preterm, that before the complete 9 months. So all these conditions would come under a high risk pregnancy. So this is the maternal conditions, the fetal conditions, and third one is the pregnancy itself. So what do we mean when we say the pregnancy itself is a high risk pregnancy? Currently, the most common condition or the most common component of this part is your IVF, or pregnancies which are born out of IVF procedures or assisted reproductive techniques, especially when they're conceived with twins and triplets. Now, these pregnancies are at a higher risk of placental abnormalities, a higher risk of bleeding during the pregnancy, the higher risk of twins, and hence higher risk of preterm deliveries. Now, these will definitely need care in a tertiary care center. Then, like what we discussed even earlier, partly are the ones pregnancies where the baby is smaller than what it should be, very low birth weight babies. You may have heard of conditions where they say that the baby is at 9 months was weighing only what it should be weighing at about 7 months. So these are low birth weight babies. So the pregnancy itself, if the mother has had previous cesarean deliveries, these are also high risk. More than one cesarean is even more high risk. If she's had a previous preterm delivery, then the chances of a preterm delivery in the subsequent pregnancy is also higher. Other conditions like which include uterine abnormalities or anything which may predispose to preterm labor. So these are all conditions of the pregnancy itself which can lead to a high risk pregnancy.